Dr. R here again with some epi questions. Let's dive right in. Here is the lead-in. Can we answer this question by looking at just the lead-in? The answer is no. So we need to go to the question stem. We're going to look at the answer options, and these are different kinds of studies. I actually see an interesting new study that we haven't really talked much about. But let's dive into the question itself. A medical student was motivated to investigate whether there exists a correlation between national cesarean section rates. So that's interesting. So C-section rates and maternal mortality. So we're looking at C-section rates and maternal mortality. Worldwide, even. That's another interesting. After discovering that C-section delivery rates are varying significantly across countries, in a lecture, must have had a public health lecture, ranging from less than 0.5 to over 30%. To carry out the investigation, the student procured population level data from an international registry comprising tabulated C-section rates. Tabulated can also suggest aggregated. Not prove that it's aggregated, but suggest that it's aggregated, and maternal mortality rates from the last decade, so over 10 years, for a total of 119 countries. So they were looking at C-section rates and maternal mortality, and they were trying to describe, does the C-section rate have a relationship with maternal mortality? The interesting thing about this is that there's a lot of talk about national level data, rates worldwide, things significantly varying across countries, and then they procured population level data. So I think that is kind of indicative of a certain type of study. But let's go back through these different types of studies. So a case series. Well, what is a case series? Haven't talked much about that. But a case series is actually a study where it's a descriptive study. So it's a descriptive study that looks at new or rare or emerging diseases that surface, and physicians will report on these case series. So for instance, we might start with a case study. So what is a case study? Case study is just one patient, often. And we might have the first patient that appears with Ebola, or the very first time we had a patient appear with HIV. Well, a physician wrote up that this patient presents with all these symptoms, these lab values, and these clinical signs, and then reports that and publishes it so that we can notify the academic community that this thing is happening. So when we get more of those cases, either HIV or Ebola or whatever new emerging disease comes out, and we get several of them, then now we're talking about a case series. Excuse me. So a case series is a descriptive study. The case study is usually a singular study of one patient, and a case series is a singular study but of multiple patients that are resembling the same kind of presentation that we might have described in a case study. So having multiples of these is important, because now we're starting to see that maybe this thing is gaining traction. Maybe it is we're seeing the new signs of an epidemic, or the new signs of something that is emerging. So that's what a case series is. So that is not what this study is doing. A case control. So did we start with cases? And then did we choose controls? And don't forget, are the numbers approximately the same? That's information that is not causative, but it is extra information. I don't see that happening here. We don't have any discussion about cases. We don't have any discussion about controls. So this doesn't really make sense. It is retrospective, right? Because we looked over the last decade. But the other information rules this one out. Cross-sectional. Is this a cross-sectional study? Are we looking at a specific period of time and collecting data on a specific period of time? Are we looking for prevalence? Remember, prevalence equals the total with the disease divided by the total population. Hopefully you're saying this before I'm actually writing it, or I'm saying it myself. Knowing these definitions is super, super helpful. So we are trying to look at folks with the disease, but in a completely different way. So we're actually looking at maternal mortality. We're also looking at C-section rates. But we're not looking at this in a way that is as one specific point in time. So cross-sectional doesn't make sense. Cohort study. Let's talk about the cohort study. So cohort study, are we looking at people without the disease and then following them over time and looking for the incidence, right? Remember, the incidence equals the number of new cases divided by those at risk. And so if I start here and then I follow them over time, we end up with people that get the disease, and these people who get the disease end up becoming our new cases. And this population here who was at risk end up becoming our at risk. So this becomes the numerator, this becomes the denominator. And that is not what we're trying to do here. That's not what we're looking at. So cohort study, whether it is prospective or retrospective, is not working. So an ecological study. So an ecological study is an observational study that collects data at the population level, right? And so that is definitely what we did here. We procured population level data. When we procure population level data, one of the downfalls is that we can't talk about a single person's risk. So if we looked at maternal death in a patient with or without a C-section, this data is not going to help us because we didn't collect person level data. We collected aggregated population level data, not person level data. So if a patient comes in and we look at this study and that patient had a cesarean section, or is thinking about having a cesarean section, can we then say, well, your risk of maternal mortality is X? No, we cannot do that because we're at the population data. So in this situation, we're using population data, national cesarean section rates, and we're looking at maternal mortality. So I hope you agree that the most likely question or answer choice is an ecological study.